Welcome to the Ulosca. Common UR 335 Exam 3 Pediatrics Guide, your ultimate resource for pediatric nursing success. This guide offers over 300 expert-crafted practice questions, with detailed rationales covering key concepts such as growth and development, family-centered care, and pediatric assessments aligned to Fall 2025 standards. Enhance your critical thinking with real-life case studies and practical examples. Subscription access unlocks comprehensive practice questions, supplemental reviews, and continuous updates, ensuring you're fully prepared to excel in your pediatric nursing exams. Visit Ulosca.com and get started today. Here are the key topics typically covered in the NUR 335 Exam 3 Pediatrics Growth and Development, Family-Centered Care, Pediatric Health Assessments, Common Pediatric Illnesses and Disorders, Pediatric Medication Administration, Pain Assessment and Management, Immunization Schedules, and Education Advocacy Roles in Pediatric Nursing. Welcome to the Ulosca. Common UR 335 Exam 3 Pediatrics Guide, your ultimate resource for pediatric nursing success. This guide offers over 300 expert-crafted practice questions, with detailed rationales covering key concepts such as growth and development, family-centered care, and pediatric assessments aligned to Fall 2025 standards. Enhance your critical thinking with real-life case studies and practical examples. Subscription access unlocks comprehensive practice questions, supplemental reviews, and continuous updates, ensuring you're fully prepared to excel in your pediatric nursing exams. Visit Ulosca.com and get started today. Here's a section with growth and development question. When a nurse assesses a 9-month-old infant during a routine visit, which finding indicates appropriate developmental progression? A. The infant speaks clearly in 2-word sentences. B. The infant pulls to a standing position and can sit without support. C. The infant scribbles spontaneously on paper. D. The infant hops on one foot when prompted. Correct answer B. The infant pulls to a standing position and can sit without support. Explanation: at 9 months, infants typically reach developmental milestones involving gross motor skills, such as pulling themselves up to stand and maintaining a seated position independently. These skills indicate appropriate muscle strength, coordination, and balance development, which align with expected growth patterns for this age group. Why other options are incorrect? Infants at 9 months are not expected to form clear words or phrases. This linguistic milestone usually emerges closer to 1,824 months. C. Scribbling spontaneously on paper is typical of toddlers aged approximately 1,218 months, not a 9-month-old. At 9 months, the infant is still developing fine motor skills, usually limited to grasping or transferring objects. D. Hopping on one foot is a developmental skill expected around 3 or 4 years of age. At 9 months, infants cannot perform complex balance tasks like hopping. Pediatric health assessments. Question 3. Which scenario best aligns with Piaget's cognitive developmental stage of concrete operational thought? A 2-year-old repeatedly throws toys off a high chair to observe the outcome. B. A 5-year-old child believes that toys have feelings. C. A 9-year-old understands that the volume of water remains the same when poured into differently shaped containers. D. A 15-year-old can discuss hypothetical moral dilemmas logically. Correct answer C. A 9-year-old understands that the volume of water remains the same when poured into differently shaped containers. Explanation: Piaget's concrete operational stage, typically ages 711, involves the development of logical thinking about concrete events. Mastery of the concept of conservation, the idea that certain properties remain constant despite changes in form, and the ability to perform mental operations. Understanding volume conservation water experiment exemplifies this cognitive stage. Why other options are incorrect? A 2-year-old throwing toys represents Piaget's sensorimotor stage, birth to years, exploring the environment through physical interaction. B. A 5-year-old believing toys have feelings is an example of animism, typical of Piaget's preoperational stage, ages 27, characterized by symbolic thinking and egocentrism. D. A 15-year-old discussing hypothetical scenarios logically aligns with Piaget's formal operational stage, ages 12 and older, characterized by abstract, hypothetical, and systematic reasoning. Common pediatric illnesses and disorders. Question 4. A nurse teaches parents about nutritional needs during adolescence. Which statement by the parents indicates correct understanding? A. Caloric needs decrease significantly during puberty. B. Adolescents require increased intake of calcium and iron. C. Protein requirements remain unchanged from early childhood. D. Adolescents should reduce carbohydrate intake significantly. Correct answer B. Adolescents require increased intake of calcium and iron. Explanation: adolescents experience rapid physical growth, increased bone density development, and onset of menstruation in females, leading to elevated calcium and iron needs. Calcium supports skeletal growth, while iron requirements increase due to growth, muscle development, and menstrual blood loss in females. Why other options are incorrect: A. Caloric needs increase during puberty to support accelerated growth, muscle mass development, and increased metabolic rate, not decrease. C. Protein needs increase significantly during adolescence to support tissue growth and muscle development, not remaining the same as childhood. D. Adolescents should consume balanced carbohydrates, as they are essential for energy to support growth spurts, activity, and cognitive functioning. Significant reduction isn't advised unless medically necessary. For more than 300 expertly designed practice questions like these, covering all essential topics for the NUR 335 Pediatrics exam, visit Ulosca. Enhance your critical thinking, reinforce key concepts, and ensure you're fully prepared for exam success.